arrow na ay kaning mouse nako, mao lang, pero di lagi ta mo makita. Uy, Ginoo ko kalisod ba ani, oy my God. Pwede mo, diba ha? Ang makita niyo lang kapag mag-share screen ako is the entire screen or just yung portion ng PowerPoint.
Yung sa PowerPoint lang po, ma'am.
Makita din
PowerPoint.
po yung notes, ma'am.
Makita ang notes. So, tibuok yun siya. Tapos, unsa pod ni siya. Ana. So, dili di ay dapat siya tawag ani. Kaysa ha. Pag entire screen, tempa. Ano, nawala. Kaysa, nawala akong PowerPoint. Struggle is real, mga kainis ako. Oy my gosh. Ang tibuok screen ang inyong makita, di ba? Tama ba ko?
Yes, ma'am.
Apil ning kaning ako ang notes.
Opo, apil ng thumbnail sa kilid. Marag mga ako.
Pati kani, as in tibuok screen. So, dili dahil siya portion lang ang makita ninyo. Alang maniay mapali.
Pwede na ma-full screen, ma'am.
I-ESC, ma'am, para isa lang.
Unsa? Ani, ma'am. Ana gyud di ay okay, the entire screen jud. Okay. To avoid infinity mirror, don't share your entire screen or browser window. Share just a tab or a different window instead. Okay. So, unsa akong buhaton ani? Ay pa ha? Ay pa. Ma-appreciate na ko ang inyong tabang pero di ko kasabot unsaon ni siya paggamit, promise gyud sa tinuod lang. I-try daw slideshow, ma'am. Kung slideshow na ko siya, sige. Pero dili ta mo makita. Ang makita ra nako ang ako arag yung slide. F5. Okay. F5. Lahi manuon ang magawa.
Huy, nawala.
Nawala na naman si Mom.
Believe din niyo si Mom.
Uy, unsa man to?
First time ba ni mo mag-Gmeet?
Uy, asa na siya? Hi, ma'am. Nakamute ka, ma'am.
Makalagot lagi ni ay dili lagi ko sa kabalong. Ala nindira uy mura nanig si Batman. Kung ako ni siyang i-F5 slideshow, daw be slideshow. Makita na ninyo?
Opo, ma'am.
Naka-full
Kana
screen
siya?
ang PPT,
Opo,
ma'am.
ma'am.
As in, kana na gyud, wala na, ano na ha? Klaro na siya? Pero dili gid ta mo
Yes po,
makita.
ma'am.
Wala jud ko makita sa inyo, PowerPoint lang akong makita.
Pwede raman guro ka mag-split screen, ma'am, para makitaan minimo sa Gmeet. Kanang split screen.
Unsaon po ng split screen? Sige daw. Uy, Ginoo ko, Lord,
Ay,
luuyan ni
hala.
ma'am, uy. Kana, unsa inyong nakita?
Kanan.
Kanan. Nagibahak man ni, uy, kalagot niya ha. Malagot gay ko ron, undangan ko ning klasiha ba? Undangan ko jud ni malagot na jud ko, promise. Wa daw ma-learn si Braille pag sure mo dira sa inyong mga gipangbati ha, kay ako pod wala jud koy na-learn. Stop presenting. Uy, seryoso jud ko ani class, uy. Ano man ni siya, uy. Ilagi ni siya maka ano sa ako ay malagot na ko. Dili gid siya. Ano man ni.
Kung lahi na lang mag-present, ma'am. Okay ra or?
Sa PowerPoint?
Opo.
Hadlok manggug ko ba basi matawag ani malik ang PowerPoint, dili manggud ako ang creator ani. Si Ma'am Haiktin. Pero kung ihatag nako sa imuha, Grace, may nang magsabot ta ha.
Hoy, sako pa dyan.
Grace,
Yes, ma'am.
sa imuha na ko ipasa ang ang PowerPoint. Pero make sure dili gyud ni mulik ha. Kay Ma'am Haiktin ni nga PowerPoint maka-award ko ani.
Sige,
Balubaya
ma'am.
jud mo dili jud ko nagapasa og PowerPoint. Sige, kadali lang. Ay, kailangan ako og email. Grace, kailangan ako og email. I-send sa ako ang messenger imuhang email.
Sige, ma'am. Now na po. Okay na, ma'am.
Okay, kadali lang. God. Dili po siya masend kay too large. Ano man ni siya, uy.
Alak. Lahi na lang magklase, ma'am.
My God,
Ay,
makalagot na siya. Dili siya masend kay too large daw. Pwede mo hilak.
Wala na siya sa G drive ni mo, ma'am, or unsa ba?
Wala. I-try na ko, ha? I-try na ko
Okay
sa...
na lang.
Ha?
Okay na lang siguro ng full screen na lang yung i-present, ma'am. Okay raman sa mo upload.
Pero dito mo makitaan, amura ko buang nag-istorya ako ra isa. Sige. Bala mo dira. Sige, kadali lang. Okay na, okay na?
Okay na, ma'am.
Okay. Okay na? Sige, balik ta. Yatay manioy. So, your sulfonamides are also known as your sulfa drugs. Okay? And this is one of the oldest antibacterial agents that was used. Okay? That was used even during the World War II. Okay? And then, like what I have said, this one was genetically modified. Kaya bitaw nga tawag ani kanang they use the compound coal tar in order to identify which medications or which kind of bacteria is suited for a particular medications wherein they invented, okay, for genetic engineering purposes. Okay, and then these are the first group of drugs used against bacteria, okay, aside from your penicillin. And your sulfonamides also are tawag ani, not classified as an antibiotic because they were not obtained from biological substances. 'Di ba? Unlike with your penicillin, ang penicillin kay kanang ang iyaha is naturally ano siya, kumbaga naturally invented kasi from bacteria good from the molds, whereas ang atong sulfonamides they are from what chemical man-made chemical engineering ang gibuhat sa iyaha. Okay, so the mode of action now of your sulfonamides is they inhibit bacterial synthesis and folic acid, which is essential for the bacterial growth. Okay? So, di ba naatay mga lahi-lahing mechanism of action for our antibiotics? Di ba naatoy mga synthesis sa ilahang mga RNA, DNA? Kani siya is ang folic acid mismo. Niya ang ginadisrupt. Okay? Ginadisrupt niya mismo ang imuhang folic acid because unlike with humans, okay, comparing humans and bacteria, humans, we get folic acid from the food that we eat. Okay? Pati sa kanang mga buntis, 'di ba? Essential ang folic acid. Okay? Para pag ano sa ato ang fetus. Now, with bacteria, they can produce their own folic acid. Kaya yun yung ginadisrupt ng ating sulfonamide. Okay, they inhibit the bacterial synthesis of folic acid production, which is essential for bacterial growth. And then, for cells to grow and reproduce, they require folic acid. Okay, so gina-inhibit yun sa atong sulfonamides ang kaning folic acid nato. And folic acid remains inexpensive and effective against the treatment of UTI or urinary tract infection, trachoma, ear infection, as well as newborn eye prophylaxis. Because our sulfonamides class, they are not just what? They are not just in tablet form, but they also comes in creams and ointments. Okay, one of the creams that we use is the prophylaxis that we put on the conjunctival sac of our what? Of our newborns upon birth. Okay? There are also sulfonamides that are incorporated for creams for treatments of burn. Okay? Kanang mga silver sulfadiazine nato ingon ana siya. Okay? So 90% our sulfonamide is effective against E. coli and useful in the treatment of meningococcal meningitis and against organisms about chlamydia and toxoplasm gondii. They are not effective against viruses and fungi. Okay? So unlike all antibiotics, pag sinabing antibiotics, they are only for bacteria itself. For viruses and fungus, okay, another medications are used for them. So, our sulfonamides are well absorbed in our GIT, especially in dito sa ato ang small intestine. It is metabolized on our livers, okay? And this is well distributed not only in the bloodstream, but it penetrates, the sulfonamide itself penetrates on the body tissues as well as your brain. Kaya nga, ang ating sulfonamides, 'di ba? If you still remember, they are really a treatment for meningococcal meningitis because they could pass, okay? They could easily pass what we call our blood-brain barrier. Okay? So, hindi lang siya pang bloodstream kundi pang tissue ang kanyang penetration. And our sulfonamides are what? Excreted through our urines. Okay? So, basing on the pharmacokinetics of our medication, sulfonamides, we have to put in mind that our patients must have what? They must have what? They should not have any problems with regards to their liver and their kidneys because, okay, the synthesis and metabolism of it goes in our liver as well as in our urines, in our kidneys, okay? So pharmacodynamics of our sulfonamides, okay? As I said, it comes in oral form as well as in ointments. Okay, ointments or creams. So kung cream siya, ito na yung sinasabi ko na yung silver sulfadiazine or silvadine. Okay, this is what we use usually to our burn patients. Okay, and then our sulfonamides are highly protein bound and displace other drugs by competing its protein sites. Kaya highly protein bound siya. Kasi nga, mas mataga at saka kung anuhon ninyo, okay, like what I said, it's not only in the bloodstream but it penetrates on our deep tissues. Okay, kaya mas ano siya sa protein bound niya. Okay, so there are two classifications of our sulfonamides. There is what we call short-acting and intermediate. So under short-acting sulfa drugs, we have sulfadiazine. Okay, this is an oral agent with a broad spectrum use. Okay, this is slowly absorbed in our GIT and it has a peak of what? 3 to 6 hours. Okay, for us to see the effects of this medication. And then this is poorly soluble in urine and may cause crystallization in our renal tubules. That's why if a patient is taking sulfadiazine tablets or a sulfa drug per se, okay, we have to really encourage our patients to what? Increase more of their fluid intakes because the chances of having crystallization is very high. And if it crystallizes in your urine, it will produce blockage. Okay? Blockage on your urinary tubules. And then of course, what will happen? There will be decrease in urine output, okay, as a result of your crystallization. What else happens? Kapag there is blocking, there is what? Retention of fluid. So your blood pressure is also increasing. And then not only that, it could also what? It could also damage your renal tubules and your kidneys per se kasi hindi siya maka-filter na or hindi niya na ma-excrete ng maayos yung mga waste products natin sa katawan. Kaya you have to really monitor the intake and output of your patient if your patient is taking sulfadiazine or sulfa drugs. Okay? So common side effects and adverse reactions of these medications. Okay? So side effects includes what? Your GI disturbances. Kapag GI disturbances na gani ang pinag-uusapan, always there is nausea and vomiting, diarrhea, and loss of appetite. If this is the problem that your patient is encountering, whether sulfa drugs or any other medications, what you have to do? You have to encourage your patients to what? Have ice chips, okay, or small frequent feeding, okay, small frequent feeding. If I can still remember, okay, during my review period, during my board exam, my what is this kanang amo ganing reviewer, he keeps on telling us that when a patient is nauseous, okay, and then there is loss of appetite, what is your immediate nursing intervention? Of course, you will be providing SFF, small frequent feeding, and what you will feed your patient as much as possible, okay, the ideal food that you are going to offer to your patient is with the use of crackers and providing your patient with water for hydration. Okay? So yun. Okay, pag sinabi ganing mga GI disturbances, okay, SFF, dayon na, ice chips, okay, and then what? Providing them with kanang crackers and water as much as possible para dili lang mag-dehydrate ang imong patient caused by vomiting and diarrhea. Okay? So headache, this is also what? This is also noted. So pwede ma-alter ang sensorium sa imuhang patient as well as mental and mood changes. Then signs of kidney problems kasi nga, 'di ba? There is a possibility of crystal formation once you are taking sulfadiazine. Okay? Lump growth or swelling in front of the neck while lain. It could induce what? Goiter. Okay? And signs of low blood sugar. Your patient might what? Might feel hungry. Okay? Or magiging, there is a feeling of hypoglycemic effect on your patient taking sulfadiazine. That's why you have to offer, okay, food. Okay? You have to offer food at least 1 or 2 hours before you are going to give the said medications to your patient. Okay. Another kind of what? Another kind of short-acting medication under your sulfa drug is your sofesoxazole or your gantrycin. Okay, this is still another broad-spectrum type of antibiotic, and this is recommended by the CDC, okay, Center for Disease Control, for the treatment of STDs, okay, sexually transmitted disease. This is useful with sulfadiazine as a prophylactic treatment for streptococcal infection and for rheumatic fever. Okay? So, patients who receive sulfasoxazole or gantrycin, okay, they are given to patients who have hypersensitivity to penicillin drugs. Okay, and this is rapidly absorbed in our body, especially in the GIT. Kaya sila tawag nito yung mga short acting because as you can see, the peak treatment or the peak duration for the plasma, okay, for this medication to take its effect, okay, is very short. After 2 hours, makita na dayon ang result nato sa atong patient. Okay? And then this is what? Excreted in the urine. Okay? Excreted in our urine and with a half-life of 4.5 to actually 8 hours na ni siya. Okay? So after 4.5 to 5 hours or 8 hours, that this gantrycin will start to lower its dose in our blood plasma. Okay? So what are the indications of our gantrycin? This is for the treatment or severe or repeated or long-lasting. Wala na lang yung giingon no na forever treatment siya sa urinary tract infection. Okay? So, bottom line class. Okay, bottom line, whether this is a short-acting or intermediate-acting, sulfa drugs is really a drug of choice for the treatment of urinary tract infection as well as your meningococcal meningitis because of its ability, if you can still remember, to pass on our blood and brain barrier. Okay? So other indications also of our gantrycin is for acute otitis media, trachoma, inclusion conjunctivitis, nocardiosis, cancroid, toxoplasmosis, as well as your malaria. Okay? So yun yung ating mga short-acting na mga sulfa drugs. What about the intermediate? So we have our sulfamethoxazole or other term. Okay, kay lisod man kayo siya litokono. SMZ or SMX. Okay, take note of that. One of the intermediate sulfa drugs is your sulfamethoxazole or your SMZ or SMX. And just like all other sulfa drugs, they have what? Poor water solubility. Okay, but comparing to sulfisoxazole, okay, mas poor pag yun ang imong sulfamethoxazole. Kaya you really have to establish what? Fluid, increase in fluid intake on your patients. Okay? So what is the action of this SMX or SMZ? They inhibit, okay, the production of dihydrofolate, which is intermediately interferes the normal bacterial synthesis of folic acid among our bacteria. Okay? And once this SMZ will block the folate production, it will now inhibit the folate-dependent metabolic process of our bacterial growth. Kaya with this SMZ or SMX, okay, nagwi-weaken ang ating nagwi-weaken ang cell wall ng ating bacteria, okay? And then as it weakens through the help of our immune system, okay, nawa-wash out or na-eradicate natin ang presence of the pre-existing bacteria in the body. Okay? So the pharmacokinetics now of your SMZ or SMX. For the absorption, it is well absorbed. Okay, once administered topically, but it becomes rapidly absorbed once you are going to take it orally. Okay, both effective topical and oral, but the effect is more rapid if you are going to administer it orally. Okay, the distribution of this medication, okay, so this is distributed mostly on the body tissues, including your sputum, vaginal fluid, and middle ear fluids. Kaya, di ba, makasulod gani siya sa BBM, unsa na sa BBB, unsa na lang kaning mga fluids na to, other fluids in the body. Okay? Ingon ana ka gaan or ingon ana ka tawag ani ang diffusion, okay, ang diffusion sa kani nga tambal all throughout our tissues, okay, and in the bloodstream, it's really fast. Okay, so aside from the BBB, it also crosses on your placenta. Okay, so isipin mo na lang, it crosses the placenta, so it is what? Contraindicated for patients who are pregnant. Okay, Kasi nga, it could cause teratogenic effects on the baby. Okay? And then, this is 70% protein bound. Okay? And has a drug concentration that occurs 1 to 4 hours even after what? Oral administration. Okay? And the serum half-life of this takes 10 hours. So comparing on your short-acting medications, this SMZ or SMX takes time, okay, before its effect or its dose goes into half in our blood plasmas. Okay? So our SMX is metabolized also still in the liver, including the 5 metabolites necessary for the metabolism of this drug. Okay? You have your N4-acetyl, N4-hydroxy, your 5-methyl-hydroxy, your N4-acetyl 5-hydroxyl-droxy. Ma'am, unsa naman ni siya, ma'am? Uy, nagpasagad na lang man ni siya mexyl-droxy-droxy. Wala tayong mabuhat, class. Sige na lang, Gora Bells na lang tayo dyan. O, di ba? Naningkamot gani mutabang kay ma'am unsaan bag klase, di ba? Sige lang. Actually, class, paspas ra ni siya. Mubo lang ni siya nga discussion. Okay? So, hopefully, before mag-alas 4, mapang-dismiss na tamo. Okay? So, lipayan na po sa mga kanahan. Oy. Okay. So, sige. Padayon sa akong gibati. Okay? Maskin wala ta mo nakita. And including on the 5 metabolites is your N-glucuronide conjugate. Okay? So those are the 5 metabolites necessary together with your liver enzymes for the metabolism of your SMX. Okay? And the mode of excretion of this medication is primarily in your what? In your kidneys, okay, through glomerular filtration, as well as it could be excreted on your tawag ani breast milk. Kaya dili gid siya pwede ihatag, or this is really contraindicated for patients who are pregnant, lactating, kay this could cause teratogenic effects on the baby. Okay, so side effects and adverse reactions of this particular, what is this, medication. Gastrointestinal disturbances like your nausea and vomiting, diarrhea, loss of appetite, paulit-ulit, okay, and allergic skin reactions. Pinaka-worst, okay, worst form of your allergic skin reaction is your Stevens-Johnson syndrome, okay? So, kapag nagka-SJS imuhang patient, pati ang immunity sa imong patient mag-weaken. Okay? There is also a possibility for toxic epidermal necrolysis. Okay? If your patient is taking this medication, okay, you really have to consider a lot of things. So, tanawon jud ninimo if the patient is already starting to manifest these effects. Okay? Hepatic necrosis, agranulocytosis, as well as aplastic anemia. Ngano pati ang tawag ani, ang kaning mga kaning agranulocytosis and aplastic anemia is common because there is bone marrow suppression. Okay, if your patient is taking your intermediate SMZ or SMX. Okay, so if there is bone marrow depression, okay, anong nangyayari? The production of your RBCs become low, and then anong nangyayari? There will be now anemia. Okay? So, kapag anemic imuhang patient, mas daghan pang mga pre-existing problems na pwede nato ma-encounter. That's why it is really important that when your patient is taking these said medications, you will not only check for their liver enzymes as well as their BUN and creatinine, but you also have to check for their CBCs, to check for their RBCs, WBC, platelets, okay? Dili jud ko kabalo kung nakasabot pa mo sa ako ang ipang istorya or wala, pero sige lang. Laban Japan. Okay? So another type of intermediate, Okay, intermediate drug of sulfa drug is your sulfasalazine. Your sulfasalazine, kung kaganina na atay tawag ani SMX o SMZ, ay SM, sa ganito, SMX o sa dato oy SMX o SMZ, kani siya SSZ pod ni siya. Sulfasalazine. Dili ni char-char ako hatinud-anay gyud ni siya class. Okay? Sulfasalazine or SSZ. Okay? Or the brand name of this medication is azulfidine. Okay? So, kaganina, okay, with your SMX, ang iyahang gitagag emphasis is for the treatment of what? Of your UTIs and then meningitis. Sa SSZ natin, this is the drug of choice for your ulcerative colitis and Crohn's disease. You also include here your rheumatic arthritis. Okay, SSZ is also a drug of choice for patients who have RA. So ganitong RA, rheumatic arthritis. Okay? So, this is carried by aminosalicylic acid or also known as our aspirin. Okay? And it is rapidly absorbed in the GIT and it takes what? 2 to 6 hours to reach its peak plasma concentration in the body. Okay? And this is metabolized still on the liver and excreted through your urine. After 5 to 10 hours, the drug dose becomes half of it, or the half-life of it is after 5 to 10 hours from the time of administration. So, bakit daw nagiging treatment for ulcerative colitis ang ating sulfasalazine? Remember that your prostaglandin, okay, which is necessary for inflammatory, okay, inflammation in the body. What does our SSZ do? It will inhibit the production of prostaglandins in our body. So, as a result, it becomes now an anti-inflammatory. Okay? Kaya siya nagiging treatment for our ulcerative colitis. It tends to become an anti-inflammatory medications. Okay? Sa ating colon, ang ating SSZ. Okay? Pati din sa ating what? Pati din sa ating rheumatic arthritis. Okay? They what? They because of its anti-inflammatory effect, kaya ginagamit natin ang SSZ pati sa arthritis. But RA only, ha? RA only. So, side effects of this medication, GI disturbances, your rash, okay? Your mga tawag nito, mga allergic reactions, your skin and urine becomes orange. Bakit nag-orange siya? Because, okay, there's a possibility that there will be hepatic problems. This is already an indicative sign of hepatic problems. Okay? Yung pagdi-discolor ng ating skin as well as the urine once taking. Kaya you really have to check those necessary mga laboratory workups and to really include, okay, water in the therapy. Kung pwede lang, you could give up to 2 liters of water to your patient. Okay, para lang yun dili ta magkaroon og crystallization, okay, once taking the drugs. Okay, like what I have said, okay, tendency of taking sulfa drugs, whether it is short or kanang long acting or intermediate, there is a possibility of bone marrow suppression. Kaya yung mga granulocytosis natin, yung aplastic anemia, kasi nga, okay, it suppresses the bone marrow to produce RBCs. Okay, your liver problems, your Stevens-Johnson syndromes, as well as your kidney problems. Okay. Another type of long intermediate, okay, intermediate sulfa drug is our cotrimoxazole. Okay, the brand name is the Spectra or the Bactrim. This is the combination drugs of sulfamethoxazole Saxol, and trimethoprim. Okay. Di ba kanina ang sabi ko, the sulfa drugs is what? The sulfa drugs is a bacteriostatic. How it becomes now bactericidal? Remember this medication, trimethoprim. Trimethoprim. This medication, lisura basahon, no? Utal-utal gini si Mamba. This medication, if you're going to combine this with your sulfa or your sulfadiazine or your sulfamethoxazole, this becomes now a synergistic effect. Synergistic effect is the combination of two medications that results in the greater result of one. Okay? Kung ma-remember pa ninyo atong mga discussion sa una, synergistic effect is the production of a greater result if given with one drug only. Okay? So, if you combine these two medications, this now becomes a bacteriostatic and bactericidal, okay, medication. Okay? So, this cotrimoxazole is effective in the treatment of otitis media, bronchitis, okay, naagihapon ang atong UTI, but this is a drug of choice for pneumonitis caused by pneumocystis carni or your PCP. Okay? Para saan yun ang cotrimoxazole? Drug of choice for pneumocystis carni pneumonia or PCP. Maugyod na siya. Okay? And this is infused over 60 to 90 minutes. And this is not given intramuscular. So paunsa siya ihatag? We are giving cotrimoxazole as a side drip. Okay? As a side drip. And we are to run cotrimoxazole for 60 to 90 minutes. Kung pwede lang KVO na siya. Okay? So this is rapidly absorbed in the GIT with a peak. And you can notice, its peak levels after 2 hours, metabolized in your liver and excreted to the urine after 7 to 12 hours. Okay, the drug cotrimoxazole dose becomes half. Okay. Pregnancy category-wise, this is category D because this causes teratogenic defects. Okay? Anong klaseng teratogenic effect? Birth defects such as your kernicterus. Unsa maning kernicterus, ma'am? Kernicterus is the production of what? Too much bilirubin. Okay? There is too much bilirubin in the blood of the baby. Okay? Kaya ang baby, because of too much bilirubin, pwede mabuta ang imong baby o pwede po worst, mamatay. Okay? And like what I said, it could pass not only in the placenta but including in your breast milk. That's why if the mother is taking cotrimoxazole and she is breastfeeding and the baby is drinking the milk of the mom, okay, ang baby man jud ang mo drink sa milk sa mom, no, lain pod. Okay, there is a tendency that the baby will have diarrhea or rashes, okay, brought about by cotrimoxazole. Okay. What is the therapeutic action of our cotrimoxazole and the rest of our tawag-ani ka ng sulfa drugs? Okay, this will competitively block, okay, the PABA or your para-amino-benzoic acid to prevent the synthesis of folic acid in susceptible bacteria that synthesize their own folate production for DNA and RNA multiplication. Okay? So side effects of those medications, in general na ni siya ha. Okay? You have your rash, your itching or itchiness, For the blood, tendency of acquiring hemolytic anemia, aplastic anemia, as well as pancytopenia, which is it happens if your patient is taking sulfa drugs for a long period of time. Okay? And then for the GI, okay, tendency your patient will have anorexia and nausea and vomiting, mga GI disturbances. So like what I said, provide SFF. Okay? And then possibility of acquiring crystalluria or crystals in your urine, or pwede po magka-hematuria. Of course, magkaroon kag hematuria kay syempre there is already block. And then brought by the pressure inside your body, magsigig ka move ang crystals imong renal tubules, di ba, ma-damage ang imuhang mga walls. Then pwede siya mag-cause og internal bleeding. Okay? Because remember, sulfonamides are insoluble even in the acids of your urine. Kaya you really have to encourage your patient to increase their OFI para ma-dilute yun ug maayo ang tambal sa ilahang lawas. Okay? So adverse effects, okay, includes also photosensitivity. Kaya once your patient is taking sulfa drugs, encourage your patient dili magsigi og pabulad sa init. Okay, o gamit-gamit pod og sunblock. Barato naman ang sunblock, and wear protective clothings, as well as what? Cross-sensitivity. Cross-sensitivity with different sulfonamides. Kung unsa ang nasugdan na sulfonamides, if there is reaction, always inform the attending physician. Okay, and then always finish the therapeutic treatment yun. Okay? Prone tayo sa hepatotoxicity as well as nephrotoxicity. Kaya we have to check the liver enzymes and the BUN of our patients. Okay? Super infections. Okay, super infections. Kaniha, I want you to remember this. Dili lang providing oral care and ice chips or sugarless candy to relieve the kanang presence of kanang yeast sa mouth brought by super infections. But isa sa pinaka-importante ninyong timanan is providing your patients with yogurt. Ngano man, okay ka ba tiyan? Diba? Maumana dyan ang tagline sa Yakult, okay ka ba tiyan? Kasi they tend to what? Produce more good bacteria necessary. Okay? Necessary for what? To increase our immunity. Okay? Diba? Sa super infections, ang yeast formation ang iyahang gina-produce. Dahil dyan, nag-weak ang atong immune system, and then pag mo inom ta or encourage na to tong patient taking yogurts or eating yogurts, we will help them boost more of their immunity, and we add on good bacteria in the body. Okay? So hypersensitivity reaction, as a result, there is Stevens-Johnson syndrome. So what you have to do, discontinue the drug. Okay? Discontinue the drug. Kay this Stevens-Johnson syndrome, this is reversible, but it will have what? Traumatizing effects on the skin. Okay? So CNS effects, your headache, dizziness, vertigo, ataxia, okay, convulsion, depression. This is due to the effects on the nerves. Okay? Kaya if your patient is receiving this kind of medication, labaw na inig elderly na, chances of having vertigo, basi matumba og kalit yung patient. That's why you have to be watchful, okay, to your patients taking this kind of antibiotics. Kay basi okay ra si ma'am niya, pag tindog niya, pag action niya glakaw, natumba siya kay nalipong siya, di ba? Instead na kagawra ang problema, nagkaroon pag fracture si ma'am or si sir. Kaya bantayan yun nato. Labaw na ni mga CNS effects. It may sound like okay ra na siya, kay headache raman, lipong-lipong lang gamay. Pero take it seriously. Kasi kaning mga gamay na butang pwede ni mag-cause of further damage sa inyong patients. Okay? So what are the drug interactions of your sulfa drugs? So this may, if you are going to combine sulfa drugs with warfarin, okay, this may increase the effects of your warfarin. Warfarin is an anticoagulant drug. So ang tendency na himo o kanang unsa kanang kabaliktaran sa espiso oy kanang lasaw. Okay? Mahimong lasaw ang imuhang dugo. Okay? The viscosity of your blood tends to become thin. So, anong nangyayari kapag ganyan? Your patient is prone to bruises. Okay? Prone siya sa bruises. Dali magkaroon og injury ang imuhang patient. Kay if you combine sulfa drugs with warfarin, naga-increase ang effect sa imuhang warfarin. Okay? And then, there is decreased absorption if taken with antacids, just like all other medicines. If you combine it with antacid, the absorption of the said medication tends to become decreased. Okay? Tends to become decreased kasi nga, syempre, your intestinal lining, okay, which is responsible for the absorption of drugs, is already covered by the antacids. Okay? And then, it increases hypoglycemic effect of sulfonylureas. Okay, like what I have mentioned a while ago, a patient taking sulfa drugs has the tendency to have hypoglycemia because the patient is what? Feeling hunger, okay, most of the time when they are on treatment of sulfa drugs. Okay? And then, what? There is also decreased effectiveness in your contraceptives. So, kunyari, si ma'am, okay, nagatake siya og pills, o niya, gitagaan siya sulfa drugs, okay? Expect that there is still a possibility for your patient to get pregnant kasi nga, nawawala ng effect. Okay, nawawala ng effect ang inyong contraceptives if given with, if we are going to give it together with our sulfa drugs. Okay? So nursing care, okay? Nursing care for a patient who is taking sulfa drugs, baseline serum creya, BUN, as well as urine output should be monitored, especially your urine output, okay? Take note of this, your patient must not have below 1,000 ml per day of urine. Okay? Once your patient is taking sulfa drugs. Okay? You have to increase, okay, oral fluid intake up to 2,000 ml or 2 liters a day or even more. Okay? And once you're giving the medication to your patient, always follow it with a full glass of water. Okay? So dapat maliban pa sa 240 ml, ma'am, asa kagikan og 240 ml, plus ang isa ka baso is 240 ml, the regular one. Okay? If your patient is taking the medicine, give 240 ml of water at least. Okay? And then if kaya pa niya, try to increase it. Kasi we really have to make sure that the patient must have 2,000 or 2 liters or more of water intake for the entire treatment duration using your sulfa drugs. Okay? Baseline CBC is also necessary kasi nga we don't want our patients to have anemia. Okay, brought about by bone marrow suppression. Liver enzymes, okay, are necessary kasi nga, 'di ba, most of our sulfa drugs is metabolized in the liver together with its 5 other metabolites we have discussed a while ago. Okay? Monitor for jaundice and icteric sclera. Unsa ning icteric sclera? This is an indicative sign of liver disease. Kasi nga, there is yellow discoloration on your sclera. Okay? Asa ng sclera? Kanang puti sa imong mata. Okay? Monitor for vital signs. Remember, if your patient is what? Having already crystalluria. Diba? Like what I have said, If there is crystalluria, there will be possibility of blocking the renal tubules. And when the renal tubules is blocked, there is fluid retention. Okay, and then if there is fluid retention, your vital signs tends to go up. Okay, in compensation to what? The pre-existing condition that your patient is experiencing. Okay, to maintain homeostasis in the body. Okay, check for fever. Okay, compensatory mechanism gihapon of our body for signs of infection. Okay, and bleeding tendencies kasi nga 'di ba, your patient is already what, taking labaw na nagatake siya warfarin, 'di ba? Anak ko mahimo ng lasaw or blood thinner ang nipis na ang imuhang viscosity sa imuhang blood. So gamay bangga lang magkabunog-bunog imong patient. Observe for hematologic reaction that may lead to life-threatening anemias. So monitor patient for signs of sore throat as well as purpura. Check for signs of superinfections and administer the medication 1 hour before or 2 hours after, and always with glass of water. Okay, just like all other medications, it is well absorbed if the stomach is empty. But case-to-case basis, kay there are really patients who cannot taking medication with an empty stomach. Okay? So nursing care in continuation, avoid or limit sun exposure and the use of sunblocks. Use clinistics to monitor urine sugar and ketones in diabetic patient, not clini-test ab. Unsa ning clinistic? Mura ni siya og kato ganing class kana ganing pangkuha nato og HBG kanang tawag ani kanang pangkuha nato og kanang sugar level sa ato ang mga patients. Okay, ingon ana pod na siya tapos isawsaw na nimo ang strip dito sa ihi, and then there will be a color indicator there. You will identify the presence of sugar or ketones, based on the color that is indicated on its container. Okay? And then, taking sulfa drugs should not be taken with antacids kasi nga we don't want the delay of absorption of the drugs in our GIT. And during the last trimester of pregnancy, dili lang kay last trimester but the entire pregnancy, okay, this sulfa drugs is really not advised. This is really contraindicated. Okay, so take note of the words or the mnemonic sulfa. There is sunlight sensitivity, undesirable effects such as your rash. Worst is your SJS. There is renal toxicity. Okay, and then look for what? Watch out for the signs of kanang dehydration on your patient by checking their urine output. There is fever, sore throat, as well as signs of bleeding. And then fluids galore yun siya. Okay, when you say fluid galore, a lot of fluids. And presence of anorexia and anemia is really high in patients taking sulfa drugs. Okay? So, tagaan ta mo og 15 minutes break. Okay. I will give you 15 minutes break. Okay. At 3 o'clock, exactly 3 o'clock, we will start again. Short na lang man siya. Okay, very short na lang. Naan na lang ta sa ika-19 slide na and we have 24 slides. Unsa may gusto ninyo? Padayon or mag-break?
Padayon lang.
Padayon lang, Luis? Padayon lang, sure ha?
Kaya sila, ma'am.
Padayon
ba?
lang, mas mawala na po signal. Bitaw, kay actually mo rin nagabagyo diri sa mua. Okay, padayon daw ingon ni Subing, ma'am. Bing, ikaw gyud dahilan, ikaw na po dire be, charot lang. Okay, sige, padayon na lang nako ha para ma-dismiss na lang tamo early. Okay. Gahilom ra ko pag sure dara. Sige, go. Sige, unsaon na pud ganito? Madali ra ha. Kay naning kamot na pud si ma'am.